I've been a registered nurse for over 25 years. I always had a passion for home care. I have reached a top number of 250 clients,
How many caregivers?
50 caregivers,
And this is in how many years?
less than about 4 years.
Oh my God. What sets you apart from the big sharks in the market?
We provide an individualized care plan for every one of our patients. They become part of our visiting home family. They can call us anytime.
What is that fire in you that makes you say, okay, I'm ready to go and start my own business?
Work hard, and then you get compensated. Have fun.
Diyana Donaldson, welcome to the show.
Thank you. Thank you for having me, Nadja.
So, Diyana, we are so curious to know about your journey. It's a very fascinating journey. And we call this the Moon Shooters podcast. We have a giant moon in the center of it because we believe that business owners are moon shooters. They are shooting for the moon. They're going against the grain. Tell us your story. How did it all begin? And just tell us the detail.
I've been a registered nurse for over 25 years, and I always had a passion for home care and home health. And since very early on in my career, I started off as a registered nurse, a staff nurse in the hospital, as most nurses do. But I quickly went into home health. And I started seeing patients in their home, and I absolutely loved it. I knew from the very beginning that this is something that I wanted to do for a very, very long time. But of course, in order to expand my experience as a nurse, I explore other areas. But I continue my education, and I experienced other things, case management and hospital administration and other responsibilities, which led me to my master's in nursing administration. And I knew then, once I received all that experience, that I can launch my own business, and I felt comfortable with doing this as a nurse.
Is there anybody in your family who is an entrepreneur? Because it takes a special breed of people to take that leap. Because a lot of people are comfortable with the day-to-day job, like they have like a 9-to-5 kind of job. What is that fire in you that makes you say, okay, I'm ready to go and start my own business?
Yes, so from very, very early on, I watched my father. My father was an entrepreneur. I owned multiple businesses, from restaurants to his famous pool hall back home in Honduras. And I was always involved on the weekends. When I didn't have school, he would bring me along with him. And he gave me little assignments, cleaning up and doing things like that. And then he'll give me a small allowance. So I was able to go after and buy pizza or buy me whatever I wanted in the afternoon. And then that's how I learned. Work hard, and then you get compensated. Have fun.
Love it. Love it. So tell us about the details. Okay, yes, you were doing, you were a nurse and you were doing home health. But what is that point in your career where you said, okay, now I'm going to go and start a business? What happened? Tell us the details around this decision-making process.
So I tell you, I moved to California in 2019, right during when the pandemic was basically starting off. And I found myself being my mother's sole caregiver. I saw her losing her independence, and we were actually in need of getting some help. So we started bringing on some assistance from different agencies. But I noticed that there was a gap in the knowledge. Having the experience that I had in home care, I knew that there was room for more. So I started investigating right there and then and looking on how to open up my own business. And that led me to starting up Visiting Home, because I wanted to make sure that everyone received the kind of care that I would like my mother to receive, with skills and professionalism and
I love it. And at that time you were employed, or you were employed for a bigger hospital or something?
Oh, yes. I was employed for a large organization, for an insurance organization. I was actually working from home, doing case management, and I absolutely loved it. So I had the flexibility to be able to help mom or oversee what was being done for her while I was actually working for her.
Right. So you saw a gap in the service that being served to your mom, and you thought, I can do a better job. But, we are in California, Dyiana. Getting licenses for stuff like that is a nightmare. So how did you go about starting all of that process?
It was certainly a challenge, Naja. I tell you, the application process is so long, and it required a lot of effort on my part, a lot of following up and reaching out. At some point, I even traveled to Sacramento directly to meet with the
Oh yeah, tell us the story. I remember you telling me this. I was like, oh my God.
Yeah, well, I was not getting a response. I was ready to launch the business, and I had caregivers ready to go. I had patients. The insurance companies were reaching out to me already and saying, when can you start? And I still couldn't because my licensing was not completed. So I said, well, the only way I can get my analyst, my assistant, to get her attention is if I go to her office. Well, I didn't realize that this was a federal building. Okay.
Hijacked her office.
So I got to the lobby and I spoke to, her director actually was very, very kind towards me. And she came down to meet with me and explained to me, I'm sorry, but we can't bring you up to our offices. But I realized the urgency, and she assisted me in completing the process for the licensing process.
Yeah.
So within that week, I had the license. When I got back home now to Southern California, to Riverside, I had a license and I was able to proceed.
Wow. That piece only is so inspiring, because I remember when you told me this, I was like blown away, because people don't think that they will do something like that. And I think that what separates entrepreneurs. There are some breed of people, we call them go-getters. Some people call people nuts, right? You're nuts. You travel all the way to Sacramento to that analyst to get her attention, to move your file in the pipeline and to do stuff like that. And that what separates like winners and losers in the game of business. So I appreciate you sharing this story, because that will help a lot of people who have visions and have dreams of starting their own business. You know, that is the separation. It's the go-getter. I'm going to travel to Sacramento, stay 10, 15 hours on the road to get to that person and get my shit done.
Yeah, it requires some guts really to get it done.
That's amazing. That's amazing. And so you launched Visiting Home, you got your license, but now what happened?
Now what happened, a lot of marketing went on, a lot of, meeting different ones. And at some point, Naja, I can't really pinpoint how, when, or who actually referred me to a large insurance company who has been feeding me basically and providing me with referrals on a regular basis. So that referral source, I get anywhere between 200 to 250 referrals per 6 months. Mm-hmm. And the numbers fluctuate because patients get discharged, or they run out of visits, or they may disenroll from the plan. So it fluctuates. But I will say I have reached a top number of 250 clients at a time that I've been able to service. Yes.
250 clients. So how many caregivers?
So we have around 50 caregivers.
Wow.
Yes.
And this is in how many years?
And this is in less than about 4 years.
4 years. And
yes.
you took your business from 0 to 50 employees basically in just a matter of 30 feet, and with 250 clients.
Correct.
That's amazing. I knock on wood. This is amazing. And the reason why I like to celebrate success stories like you and showcase the community, like what you do and how you do it. And so what do you think? Yes, there are you got this referral source, but then keeping clients happy and having a happy patient or happy customer. So walk me with your process of how you service the clients, and maybe educate us about what is home care.
Thank you for that question. That's a commonly asked question. What is the difference between home care? Home care is basically non-medical services. These are services that are provided by non-skilled staff. So they usually do not require a degree, but they are required to be registered with Department of Social Services, and they have a life scan or background screening, as well as they have to have a good personality. They have to get along with people. They have to like older ones and be able to assist them. So they assist them with activities of daily living, personal care, and then also light housekeeping services. So that is what home care really is. Now, we also provide home health services. Now, that is where we provide the skill services, nursing, physical therapists, occupational therapists, speech, and we even provide social work services and home health aides. So those are under the medical, visiting home medical skill services.
Right. So let's unpack this and talk a little bit more in details about it, because it brought me some confusion, and I'm sure that it will bring a lot of people some confusion. So you have two branches, two services. One is the home care or non-medical services, and one are the medical services.
Correct.
The non-medical services are provided by caregivers who don't have to be licensed nurses, where the medical side do have to be licensed nurses, correct?
Correct.
And when it comes to the home care business or home care services, when you say assisting in daily living, something like that, you mentioned something like that. Can you tell us more examples? What does that entail?
Sure. The assistance of activities of daily living include their personal care. So it may be assisting someone with their grooming, dressing, changing their shoes. They also assist them with taking a shower or bath, brushing their teeth, combing their hair.
Laundry.
Correct. So that's more of the IADLs, what we call the laundry, shopping, medication reminders, because being that they're not licensed, they're unable to administer medications at this point, but they can remind the patient to take their medications. They can assist them by giving them a glass of water and pointing to the medication bottle, the opening of the medication bottle, so that it'd be easier for the person to take their medication. So those are some of the things that they can assist.
Very good, very good. And, so you help them stay at home, basically.
Correct.
Why is that important?
It's so important because most people want to stay home, Nadja.
I would want to stay home when I get old, 100%.
But we have an option between being in a hospital or a nursing home. Most elderly people want to stay home.
Yes.
They're familiar with their environment, and they're comfortable. Even with any infections or anything, they are just used to that environment, so that they're not exposed as if they were when they were in the hospital or even in a facility, a nursing home or rehab facility. So keeps them healthier, longer.
And mentally healthy too, because they
Yes.
feel like they're still at home, that the comfort of home. There's something about home, especially if you live in a house for a long time, it becomes part of you. And being detached from it in your most vulnerable time during, the older age is a little bit traumatizing, I think, for a lot of people.
I agree, and allows the elderly independence.
Yes.
Too, to be able to pick up the phone and call their friends and still have the neighbors, coming by to visit.
So tell me, who is your best customer when it comes to home care? We're going to talk about the health services, but for that home care, who is the best customer for you?
The best customer for me are those clients that have been referred by other clients, right? That they have the means to be able to afford the services. Maybe someone who lives home alone, who has multiple diagnoses, needs assistance with ambulating, needs assistance with maybe grocery shopping or laundry, or may need to have someone accompany them to a doctor's appointment. Right? Those are some of the things that our caregivers can assist with.
Right. And, I come from a culture, I don't know in Honduras, but I'm from the Middle East. And in Middle East, usually kids take care of their parents. But in modern day living, look at me. I'm here in the U.S. My parents are in Lebanon, right? So I'm not by any means being able to care for my parents. And so I'm assuming in the U.S. it's the same thing. When people have kids, but then kids are out of state, kids in busy with their lives, with their jobs. So, but then their parents are left alone. So do you get calls from people, millennials, for example, telling you like, hey, could you assist my parents? Is this how it works?
Absolutely. So one of my best customers that I can think of is a patient that I had for a few years now. The daughter was looking for someone to assist her mom just for a few hours. She needed help with taking out the trash. It was really difficult for her. So it started off that way. The caregiver will go once a week for a couple of hours, assisted her with some light housekeeping and taking out the trash for the week. Well, as we get older, we need more assistance, right? So now her needs have grown from 1 day a week to 3 times per week. So then now the caregiver assists her with a little bit more in the home. Besides their light housekeeping responsibilities, she also needs assistance with personal care now and ambulation.
Do you charge like people are I know what people are thinking right now. They're like, oh, how much does it cost, right? So do you charge per hour or like how does it work?
Well, first, I like to say that a lot of insurance companies will cover this kind of service. So I would recommend that everyone really looks into their benefits and researches that. Then once you have identified how many hours will the insurance company will cover, then we can maybe supplement if there's more of a need, right? So this kind of service is based upon the needs of the patient. Of course, if someone is bed-bound and needs assistance with getting out of bed, rolling in bed, that requires the caregiver to provide even more physical assistance than someone who is ambulating, right? So that's the reason why there's differences in prices. And it's based upon an assessment. So basically, we do an assessment in person, depending on the need, or over the phone. And based upon that assessment is how we determine the prices. Now, on our website, we have a list of packages that we do offer. And then the family member can review those packages and then determine what will work out best for them. We can discuss that, and then the prices will be based upon that need.
Perfect. Okay, fantastic. All right, so medical. So the same patient that needs caregiving might also need medical, or they are completely separate patients?
A lot of our patients that are currently receiving non-medical services at some point will require medical services. So after an admission to the hospital, that the patient will come back with more medical needs. So yeah, we do have a lot of our patients who have both, right? The medical services are usually for a short period of time. For the most of the times, the medical services are required for about 9 weeks of service. And then they'll get reevaluated, and then we'll determine if there's a continued need for additional services. The non-medical may be long-term for the lifetime of that patient.
Got it. Let's define medical. So what are the services that entail under medical services?
So on the medical services, the services are skilled nursing, physical therapy, occupational therapy, speech, and also social work and home health aid services. So these services are more skilled, right? They require licensing, and they are, provided at a visit rate. So the nurse may not stay there for a long period of time, unlike when they're receiving non-medical services where the caregiver will be there for full 4 hours, 6 hours, 8 hours, et cetera. But the skilled nursing service is something that the nurse will come in, they do an evaluation, the physical therapist will come in, they will evaluate, and then they'll do a treatment with the patient, and then they'll move on to the next visit, the next patient.
Kind of like when you're in a hospital and the nurse will come, check on you, clean up your wound, and then leave to the other patient. The same goes but it's in the house. So they will come to your house and they will give you the treatment. But give me examples of people that need something like that.
So for skilled nursing, for example, will be someone who needs medication management, medication teaching. They may need to know the diagnosis, understand their diagnosis, such as diabetes. A lot of people will need to know the signs and symptoms of the diabetes, how to treat it, and then about their medications. We may teach on exercising and their diet, right? Some of the things We have a lot of COPD, a lot of people
What's that?
a lot of people with chronic obstructive pulmonary diseases like emphysema, asthma, bronchitis. So those are chronic conditions, and a lot of the patients they have different treatments that they need education on, and from time to time they may have an exacerbation of their disease that causes them hospitalization. So in order to prevent that hospitalization, the nurse will come, do education, and do preventative measurements so that the patient does not get admitted, contact the physician if there's a need for a change in the medication so as to prevent them from being hospitalized. We do also a lot of home safety evaluations. We have a lot of patients that at times, especially elderly patients, they love, for example, loose rugs around the house. So they have all these little pieces, cut up rugs around, and they trip, and they could be a fall hazard. So for that, we do a lot of teaching regarding that, and then teaching regarding ensuring that they have enough lighting and ensuring that they utilize their assisted devices. So those are the kind of patients that we basically will treat with
The medical services.
the medical services.
What about like people who just endured surgery, the post-surgery treatment? Is this something as well that's involved?
Absolutely. Post-surgery, they may come out of the hospital with a wound, so the nurse will assist them and teach the family members a lot of times on infection precautions and wound care. Again, we teach diet, medications.
But not only you teach, but you also administer the service until the patient is able to administer it themselves?
So we do the wound care, correct. But the goal is for us to teach the patient, teach the family, so as to allow them independence, right? So a lot of times the nursing services are not provided daily. Only in some circumstances are they provided, on a daily basis. But usually there is someone, friend or church member or family member who can assist with that.
That's wonderful. And injections and stuff like that. Some people need injections.
Yeah, so that's something that the nurses go out and provide injections also as needed. And
I love that, what you're doing is like, even if it's probably more beneficial for you to continue that service for long term and charge more, basically, you are opting in for teaching the patient, teaching your family members, so they don't really need your service. And so you're teaching them how to fish and not giving them the fish, basically. And is this the standard practice, or this is your way of doing it?
So I would say, for the most part, a lot of the patients that require skilled services, these patients are Medicare. They have Medicare as their benefit, right? So a lot of them are 65 years or older, and therefore Medicare has a lot of restrictions regarding how home health is provided, and they do look a lot into our data. We submit actually our data directly to Central of Medicare Medicaid Services for review. So, and then our services are basically rated, and based upon those ratings, how the patients are able to find us, and they're able to make a decision: do they want this home health agency who would teach me and allow me independence to provide my services, rather than somebody else that will want to tag along and not give me what I need in order for me to be independent with my services, with my care.
Right. So your referral source for the home care versus the home health are different?
Yes. So we do service a lot of insurances. For a non-medical, a lot of our referrals are private pay. So I have to say that for the non-medical, it's so much more easier to afford, right, the non-medical services. For the medical, a lot of times it's insurance-based.
Mm-hmm. And who refers you for the medical? Is it the case manager in the hospital?
Correct. So the case managers can make referrals. Social workers make referrals. A lot of doctors, offices, they have their office staff also call us up and say, hey, we have a referral, we have a patient who needs your services. So all we need is basically a doctor's order.
Oh, you need the doctor orders. It's not like an optional. It's a requirement.
It is an absolute requirement to have physician orders before the nurse goes out or physical therapist goes out to see the patient.
Let's say someone is watching right now and they're like, their mom and dad or one of them need somebody to administer some medicine or clean up a wound. They cannot just call you right away. They have to go to their doctor, and then the doctor has to refer
Well, you can certainly call me, and I can assist with that, conversation with the doctor and getting those orders from the doctor. They're used to talking to us, so we kind of know the language to use. And they're very open to, it helps them to protect themselves, and it gives them the opportunity to be able to provide better care for their patients, because basically home health is an extension of them. It's an extension of the hospital. So that in order for them to get compensated at a higher level and prevent rehospitalizations, which actually helps them with their ratings and helps them with the higher pay, right, through the insurance companies, they benefit from our services. So yeah, they work very close with the home care agencies. They want to make sure that their patients get what they need once they get home, so they don't have to come back.
I love it. So I think and hopefully the audience as well, we have a clear understanding of kind of your journey. You started this business, you have 50 plus employees, you have 250 plus patients, and you do medical and non-medical. Now, the question that I've been dying to ask you is, in every industry, it seems that there are the nationwide sharks in the market, and then there are the city or the local boutique companies like me and you. So what sets you and Visiting Home LLC apart from the big, for example, sharks in the market, the nationwide companies in your space?
I would say is that we provide an individualized care plan for every one of our patients. They become part of our visiting home family. We are local providers, and they can call us anytime. They can see who we are. A lot of the patients, they will go onto my website and see me, and then see me in their house, providing them their service.
Yeah.
So it's a different kind of relationship. I would say that these big corporations in which you never have an opportunity to meet their CEO, and you don't even know what they look like. You don't know who they are.
Then if you have an issue, you get stuck with the bureaucracy of corporate.
Correct. In this case, you're able to reach out to me directly. Of course, my staff, they are, provide assistance to me. But yeah, a lot of times my staff, my patients, they know who I am. And they're very comfortable with calling me directly and speaking to me. So
and all I love your staff. Like I have a lot of encounters with your team, and you have a good eye. You know how to pick the right people. So talk to me about your staff. Do they go into training? How do you choose the people that you want to work with?
So I have to tell you, one of the things I take pride in is training, ensuring that my staff have the skills that they need in order to be able to be successful. And so I have a personalized training set up that's in office. Some from time to time, depending on the location of my staff, is done via Zoom or Google Meet. But I make sure that I meet with them personally and directly to make sure that they are getting the information and they're able to ask questions. In addition to that, I have recently signed up with a training agency, very well known. A lot of the large organizations actually use them, called Relias. They have hundreds of trainings available for office staff, as well as for our caregivers and nurses and our therapists. So I'm very, very excited to be launching this new training us with my staff and giving them the opportunity to be able to expand their skills and to be able to help them to learn more about what they do.
I love it. And so providing the training is one thing, but vetting the caregivers who are going into the houses of these people? How do you vet them? Because I'm sure it's a concern for, let's say I want to send a caregiver to my parents' house. I need to make sure that I'm sending someone who's not going to steal, not going to abuse, right? So there's a lot of things that goes into it. So how do you vet the people that you hire?
It's a challenge. Definitely the training that we provide with ensuring that there's clear communication between the patient and the caregiver. So we train on things like if you go to the grocery store, ensure that you notify the patient how much money, how much cash you're taking from them. You're giving me $20. And then when you come back, you show them the receipt you gave me and say again, you gave me $20 and these are your $2 change, right? So verbalizing those things back to the patient, especially those that have are forgetful from time to time, has really set things clear, ensuring that they're very clear and they always provide a receipt. And I also reinforce the fact not to use credit cards for any of our patients. I use small amounts of cash. So that's all part of the training that is inculcated and during the initial training. It's a requirement that we provide a 5-hour training for all of our caregivers. And then in between that, we also provide in-services where we actually would reinforce this information. And then we also provide, at the end of the year, we provide an annual training to all of our staff. So that will go more into detail, and we focus more into more diabetic management, fall precautions, and then more trainings on activities of daily living, and then how to prevent, emergencies.
Do you do background checks?
We certainly do. We do a thorough background and life scan check, which checks on FBI background, as well as we check for references. And we also require TB tests on every one of my caregivers to make sure that they're healthy, and list of immunizations as well, up-to-date immunizations. So that's all part of our check-off list.
That's perfect. You basically tick all the boxes.
Thank you, Naja.
So this has been great. I think a lot of people will appreciate the information that you provided, and what sets you apart as Visiting Home. You are based here in Corona.
Correct.
And what are the what are the geographic areas that you serve?
So our main office is in Corona, but we service Southern California.
The entire Southern California.
We certainly do. We service San Diego counties. We service Riverside, Orange County, Los Angeles, as well as Riverside and San Bernardino.
All of these counties are
being serviced.
It's not like you want to service. You have already patients there and caregivers.
And caregivers providing the services there already.
That's
correct.
Amazing. So let me ask you this. How do you, what are your lessons and your challenges as a business owner? What are your biggest challenges, and what are some lessons you can share with the people about this business and how to run it?
Yeah, I have to say that one of the biggest challenges is finding qualified staff. People that have the right heart and that they want to do the work. It's a tough job, Naja, to care for others, right? And we have to remember that these people are sick. They're not happy, right? So to come out to their home, in their environment, they have different rules and restrictions of what you can and you cannot do in their home. That in itself poses a challenge for anyone coming in, right? So those are but I believe with good training and teaching the caregivers on how to deal with difficult people, it's something that can assist. And also training the office staff on how to support the caregivers out in the field. It's crucial in this business.
Yeah. You touched on something very important. We're all going to get old one day, and we're all going to feel pain in our bodies, and we're all going to be grumpy. And hopefully, maybe this is a good something to live by is not to be too grumpy to the people that are trying to help you. So,
Yes.
but we empathize, and we're all gonna be there. And I think it takes a certain breed of people who are able to do the jobs that you're talking about. And as an employer, what are the benefits for being employed with Visiting Home?
We try to provide flexible schedules for all the staff, ensuring that when they need time off, they get that. They need to go see one of their kids' games, soccer games, football games, whatever it is, that they have that time available and they're able to attend. Those things are important for our staff. They love the flexibility. Also, we ensure that they have 401k benefits. They have sick time available to them. And we all know most places, they give us a week or two of vacation, but that's not enough. So being able to allow them the flexibility and be able to support them and provide coverage when they need that extended time because they have a family member that they haven't seen in a long time and they need to visit with, that they're able to have that time. And that's something that Visiting Home really tries to provide and tries to be as flexible as possible with our caregivers so that they're happy and they're comfortable providing the services.
Yeah, because happy caregivers means happy customers.
Happy clients, yes.
Happy clients, yes. All right. So what is your goals? What's 5 years down the line? What do you see Visiting Home?
I see Visiting Home growing and providing even more medical services and focusing more on our new venture, right, that we started off this year in 2025, and moving that along and making it grow into something in which we're able to cover and become more of a well-known agency in Southern California. And we have even had conversation about expanding to other states.
Wow.
So looking forward to the challenges that the next 5 years will bring and be able to really grow to that point.
And what drives you? What's this ambition? Where is it coming from? Because a lot of people would be like, okay, I'm fine now. Like, why do you need to expand and to grow?
It's a very good question. Like you say, is this drive inside of me? It's just something that I just can't pinpoint to what calls me to this and wanting to do this work. But I think that what really is helping people, it's really being able to satisfy that need. And I know, through my experience in the past few years in this business, I've come to know a lot of people that didn't even know that this benefit existed. And I'm sure that there's a lot more out there that need help. Parents living at home by themselves, like you mentioned earlier. Kids that don't know that their parents can actually benefit from something like this, that this even exists. So, get into those people and actually being able to help them and being able to provide the services. That's when I believe that I'll get the satisfaction that would.
You've answered one of the best ways possible about the expanding your impact and we have a lot of trees around us here in the studio. You can't tell the tree to stop growing, right? It's like it's innate. We are growing by nature, and business is the same thing. If the business stops to grow, it's either it's gonna be dying very soon. It's like it seems it's inevitable, and that's why you see none of the business owners will want their company to stop growing. Everybody wants to reach for that moon, right? So I appreciate you coming on the show. I think you've dropped a lot of wisdom, and you're amazing in every way possible. We have a long-standing relationship, and I appreciate you for everything you do. And any last words?
Thank you. Thank you very much for having me, and I appreciate your trusting me and wanted to bring me on, so I appreciate it. And thank you for your support, and you have been of a lot of support to Visiting Home throughout now a few years, and we appreciate it and look forward to continue to having this partnership.
Thank you very much.